Okay, and then Laura, do we have the version 2 of the slide deck loaded?
Yes, this is version 2.
Okay, perfect. Okay, well, welcome everybody. We're going to go ahead and get started here. My name is Brian Campbell. I'm here with others from DMAS, most notably Chris Gordon and Tammy Whitlock from our executive leadership team. We're going to do an informational session today. We would like to capture your questions in the chat. We will save that for those that are, the questions that are relevant or polite comments that are relevant. We will save those and share those as frequently asked questions on our website as soon as we can get those out. So we really appreciate your feedback and questions, and no question is a bad question today. There's a lot going on. It's very important. And so, feel free to ask questions today. Again, that's one of our major goals today is capture questions first, during the call. We have our transition coming up on April 4th. And one of the key things that we want to cover today is making sure that providers have access to the new portal so they're eligible to begin doing system updates to your own accounts beginning March 21st. That might seem like a long time off, but it's not. The deadline's March 7th for you to do some of those updates. But I'm going to turn it over to my friends here for more information. And I guess I'll turn it over to Chris Gordon and Tammy Whitlock.
Thanks, Brian. I'll go ahead and do the opening and Chris can follow if he wants. Just wanted to welcome you guys. Thank you for jumping on this webinar as quickly as you could. This will not be the last one that we do. I feel certain that after we get your questions, we will need to do more. So we will filter those out and make sure that we take those back and prepare materials to help you throughout this process. So just wanted you to understand this is not a one and done. We will be here for questions and we will do more webinars as we see the need. So I'm gonna jump off right now for another meeting, but please ask questions and put them in the chat. And thank you guys so much for joining us. It's very important that we get this information out to you in the best way possible. And we hope this works for you. Thanks.
All right, good afternoon, everybody. My name is Chris Gordon. I'm the Deputy for Finance and Technology here at DMAS. And you'll hear a lot about terms today that you may or may not have heard before. So we're going to be very deliberate and intentional in making sure that we explain what those terms are and how that impacts you and how that affects you. Over the last 6 years, the agency has been working to change and modernize our existing IT infrastructure. On April 4th, the last pieces of the puzzle will fit into place. The last pieces of the puzzle will be there and go live. And so this webinar is the first of many that are going to, excuse me, that are going to help explain what's happening, what's expected, and our call to action. So we have a very detailed agenda lined out there. The first, we're going to be talking about the MES transition timelines and specific impacts. Then we're going to talk about the outage from March 30th through April 3rd and what that means. We're going to share some web page resources for you. We're going to go over frequently asked questions, waiver resources, and provider trainings. And then lastly, if you take away nothing else from this, where to go for help. And that's really the big thing. Where can you get additional information from? So with that, I'll turn it back to Mr. Campbell.
All right, I'd like to introduce Mary Ann Passione and Carla Russell for the next topics.
Welcome. This is Mary Ann Passione. I'm the acting Chief Information Officer for DMAS and have been working with our MES modules and our current Medicaid claims processing vendor Conduit on this transition as we go into this modular system. just to let you know, we have a new provider portal that will be going live, and I'm going to turn this part of the conversation over to Carla Russell.
Good afternoon. My name is Carla Russell, and I am the project manager for the provider services solution that Marianne was referring to. This is the new vendor and the new solution for provider enrollment and management activities with DMAS. Part of that project is to transition to a new portal. And so we have very specific requirements for anyone who needs access to that portal. So you should see on our DMAS website, there have been multiple communications related to updating information necessary to access the portal. Laura, can you make it so that I can share my screen, please? Is Laura still on? Thank you. Okay, can you all see my screen? Okay, so
Yes, we can see it, Carla.
on our DMAS website, and we will put this link in the chat, and it'll also be in the slides that are sent to the participants. There's lots of information on the Medicaid Enterprise System and the provider services solution. And for this audience, it's primarily fee-for-service providers. So when you go out to our webpage, there are under providers, Medicaid Enterprise System, fee-for-service providers. The communications that we've sent out to providers are available on this web page. If you have questions about the portal transition, there have been multiple messages. The most recent message is the one that you need to pay attention to, and this is the last chance to update accounts. So if you click on the frame and the link for last chance to update accounts, it gives you information on why you need to update the primary account holder for your portal account. We need that information by March the 7th if you're an active primary account holder and you want to update your primary account holder. If you're not an active primary account holder, you can go to the Virginia Medicaid portal, and I'm clicking on the link in that communication, and it will take you to the information on the VAMIS Medicaid portal with detailed instructions and guidance on how to update your primary account holder and what the requirements are to do so. Again, the deadline to do that, to support everyone who's a current registered provider to have access to the portal on March 21st, is to get those updates completed by March the 7th at 5 p.m. And then, Marianne, if you want me to share the other important dates, I can do so, or I can pass it back to you. You're on mute, Marianne.
You can go ahead and share them, and then I just have a slide at the end to recap.
Okay. So other important dates related to provider and the provider portal include that on March 18th, PRSS will begin to generate provider portal credentials. So sometime between March 18th and March 21st, providers will be that have updated their primary account holders will start receiving emails so that they can go out to the PRSS provider portal to set up their delegates and set up the relationships. That's the only functionality that will be available on March 21st. So The other important activity that's happening on March 21st is that the primary account holder form will be available for providers to designate their primary account holder if they miss that March 7th deadline, or if you're inactive and your organization administrator was assigned as your PAH because we did not have primary account holder information for you, you can go in on March 21st and access the new PRSS PAH form to perform an update. So those are the kind of the three important dates related to portal transition is March 7th by 5 p.m. Submit your PAH updates if you're an active primary account holder. And here's the information on the requirements for that. And then if you're inactive and you can't get your PAH information update or your primary account holder information updated, you will have the opportunity to do so with a new form starting 3/21. So passing it back to the next panelist to address additional agenda items.
I think we're ready for Kimberly and Tia.
Good afternoon, everyone. I wanted to make sure, Marion, did you have another slide that you wanted to share?
I thought that, go back to your agenda.
Yeah, Laura might be uploading that now. So
Okay, on the agenda, I believe the next item was outages. If I remember correctly. Is that on your agenda, Brian?
Correct. That's the next agenda item.
Okay, thank you so much. So yes, I just wanted to go over that with you. In order to prepare for our transition to MES, to our Medicaid enterprise system, we will be taking down the current claims processing system after close of business, after the March 29th at 8 p.m. And so the system will not be available for us on the 30th, 31st, 1st, 2nd, and 3rd of April. What that means is that the help desk cannot look up any eligibility. You cannot look up any eligibility. You cannot look up any claim status, and we cannot tell you. If you call the help desk, nobody will be able to advise you of any claim status at that point. We will not be getting new eligibility from Department of Social Services during those 2 days. However, we will catch up with that eligibility first thing in the morning on Monday morning. We do have provisions out there for all of our vendors, and through our business owners, and DMAS should have reached out to their respective vendors and how to handle should a person come in over the weekend or on Thursday or Friday and say that they have Medicaid coverage, on how to handle that particular situation. The most vulnerable one is pharmacy. Pharmacy already has a plan in place, you know, for a 72-hour dispense of medication should a person, the eligibility information isn't right in the system and it has to be researched. In addition to that, our pharmacy team has put together plans with Magellan, who is the PBM, to make sure that that person does not walk out of the pharmacy without the medication. DMAS has guaranteed that we will pay for those prescriptions. If that person ends up not being eligible for some reason, that we will make sure that the provider is paid. And that goes across the board for all of the services that may occur during that outage period of time. And in addition to that, we will be putting out a Medicaid memo. The tentative release date is this Thursday. This Thursday, we'll be providing information that will be mostly important dates and where to go for information with contact links and telephone numbers. Also, I'll just let you know that DMAS is setting up a Tier 1 help desk. And that is not for providers. That will be set up for our vendors and to call in should they have any kind of a situation. But we also can help direct information to the right place should a call come in. So that is a newly created help desk that's just getting set up just for this particular implementation. So I think that's all the information that I have to share at this particular time, Brian.
And then I guess we should go ahead and turn it over to Tia and Kimberly Shaw to go over web resources and provider resources that are available. And then Kimberly, do you want you to take over the screen?
Sure. Thank you, Brian. Good afternoon, everyone. My name is Kimberly Shaw. I am a project manager from the PMO department responsible in assisting with provider training. Laura, you can give me control so I can share my screen. Can everyone see my screen?
Yes.
Okay, as you can see, Carla referenced this website earlier. It will also be provided in the chat, but this is our MES portal webpage for our provider community. As you can see, we have a lot of information available. One of the things that I want to point out is our FAQs. If you click on this link here, it directs you to the FAQs that we've developed for our MES launch. If you actually click on each one of these, it will expand to the questions. So we have taxonomy related questions. We have payment pause, old and new websites, updating account and primary account holders, provider enrollment, and MES training. Again, this is our FAQs that we will continuously be updating to provide the providers additional information regarding the launch of MES. Also on this page, if you can see to the left, is our MES training. We have training available for the provider training, appeals portal, and CRMS. If you can see below, it's a lot of different information to assist with the training. If you click on the provider training, it actually gives you a course listing of the various courses that are available. You see the courses that are listed here. We have virtual, we have instructor-led, we have self-paced, and we have user guides. The live courses that are also available, our training started on February 15th and will end on April 1st. So if you scroll down, there are links for the live training. So if you see, for example, we have the PRSS 111. For the live training, we have PRSS 111, which is provider enrollment. We have PRSS 118, that's intro to provider and MCO delegate management portal. And then we have live training for PRSS 120, which is the intro to the provider portal. So if you click the link here, it allows the providers to log in and sign up for the different portal training that's available. This allows the provider to register for the training. Going back to the MES training homepage, again, we have other various links for the appeals training, and we have the CRMS training. And again, the FAQs is listed over here. That's real quick, a brief overview about the training and the provider training that's available. Again, the provider training began on February 15th. It will be continuing until April 1st. The providers will go to this website, excuse me, to sign up for the training and to get various resources and download various user guides for our training that's available. I will now pass it over to Tia.
Thank you, Kimberly. And do you mind displaying that provider training resources page again? Good afternoon, everyone. My name is Tia Lewis. I'm the director for the Program Operations Division. So our division basically houses the business side of this project. So we've been working extremely closely with everyone to get this exciting project launched. I just wanted to point out some helpful things. Thank you, Kimberly, for sharing with us all of the training information. But to the right of that training page, there's going to be a helpful little box that shares downloads and very helpful information from the business perspective that'll be helpful for you to not only know, but share with everyone who will be doing your billing or any type of follow-up. There will be some changes coming up with MES, and we are releasing information as much as we can in regards to how you do your billing and requirements for your claims processing. If you look under the download section, you'll be able to choose helpful dates. The one that's being displayed just now was extremely helpful because it's in regards to your payment cycle. And I know that that's one of the first questions you may ask. If you heard Marianne talk about the freeze, and then we talked about the launch on April 4th, this little grid will give you a good idea of when you can expect payment in regards to any cycle of claim that you've submitted. So please use this as sort of a key or a guideline to assist and help you understand when you'll be physically receiving your payments and how this project is going to affect that. If you could go back, Kimberly, to the box, if you don't mind, there will be information in regards to taxonomy codes, which some requirements have changed in regards to taxonomy with this project. So internally, we've created documents that you can sort of use as a check sheet or a cheat sheet to assist and help you to understand how your billing is going to operate. Kimberly, could you go back one more time? I think it was one more thing I wanted to point out. That's pretty much it. So anything else going forward that we give you that is sort of like a support document will be located on this provider training website, and it'll be in that same little right-hand corner. And as we move forward and based on whatever information you share with us today, we will expand upon that list and make it grow so that you'll have everything that you need as far as when Go Live is happening. And I think I'm ready to pass it on to either Brian or the next speaker.
Great.
Ryan,
I'll pass it back to Marianne. Yeah. And
Yeah,
I think
I just wanted to add, I'm sorry, I just wanted to add to Tia's message there. Two things are really important. You saw that we brought up a taxonomy list. There's another taxonomy list out there that displays all taxonomies as it applies to DMAS and to your claims processing. So we have an edit in the system that says that a taxonomy is required on all claims. This is pharmacy excluded because the HIPAA compliant transaction for pharmacy does not include the space for a taxonomy, but all other claims, not crossover claims or not pharmacy, all other claims require a taxonomy. If you don't put in a taxonomy, then your claim is going to deny. You know, you pick if you are a new provider type specialty combination in our system, then there has been a taxonomy that would have been assigned to you. But if that is not your taxonomy that you use, you know, after the system comes up for Go Live, you are welcome to go in there and change the taxonomy to what you think reflects your business. In the meantime, when you send in the claim, initially, we will deny if a taxonomy is not there, but we are not validating that taxonomy against your provider record as we initially come up. We understand that this is a learning session. This is our first step to make sure that everybody understands that they must submit a taxonomy. That is not necessarily true for DD waivers. In many instances, they have to have the specific taxonomy. They know who they are. They're doing it today. This is nothing new to those providers. So I just want to make that clear that you know, taxonomy is a required field as we go live. I also just wanted to go over these dates again. I know Carla went over some of them and I went over some of them already, but they are really important information. Our vendors are going to start getting the provider converted data starting on the 13th of March. So even though we're not going live until March to April 4th, we have started our implementation as of 3/13, and we've been doing, you know, baby steps all along this way. The second one is that, you know, the PRSS portal will be open for the delegated registration on the 21st. Carla talked about that in great detail, and it is in your best interest to get that work done, set up early while that system is open. We are freezing our system as of the 25th. As far as claims are concerned, and that relates back to that chart on your claims payment. And regarding the claims portal where it says we're not going to be able to work any more pending claims, we won't be able to do any adjustments, there won't be any more access to member claims, claim status, etc. Even your vendors who might send in a 270, 271 EDI transaction for you, they will not have access to provide that information back to you. That it also includes Medicall and AVR. So when the system is down, it is completely down. There is nothing that we can access in that point, at that point in time. We have worked out situations with our vendors at Department of Behavioral Health and Developmental Services and with KeyPro and internal to DMS for service authorizations. Also, again, that MMIS outage starts on the 30th, and then the system will come back up on April 4th. So I just wanted to reiterate those key dates to everyone. Thank you.
Great. I want to thank everybody again. Laura, if you could move to the last slide just with the contact information and there are the links to our main, portal resources or provider resources. Again, we'll post this to our DMS website for reference, but please check into the main DMS website and start tracing, communications and over to the new portal for all this wonderful training information. And then Kimberly or anybody else, if you had anything to add, we have a couple minutes left.
Hey, Brian, this is Chris. Can you hear me?
Yes.
All right. I've had a couple questions in the chat that I'm going to read and ask Carla to respond to. So one of the providers has indicated, we're struggling to validate who the primary account holder is. I completed forms well before this deadline, but I don't know if it was accepted or not. So what could we tell this provider?
You should have received confirmation from MMIS if you submitted an update form. However, if you did not get confirmation, you can always reach out to the web support number on that's documented in the FAQs or documented in the PAH update instructions. They are still assisting primary account holders through the 3/30 date at web support. And I can put that information in the chat. If they're not assisting, then your other alternative is to make sure you submit an updated form on 3/21 when the new PRSS PAH update form is available. But we will also confirm with MMIS what they are doing with those new PAHs. Did they issue new credentials, and add that information to our FAQs?
The next question is, moving forward, we will have to have one primary account holder for our tax ID number, and then they can grant access appropriately to those who need proper access to each MPI? That's a question.
Yes. So in the new system, it requires one PAH for every tax ID number. So the hierarchy is based on tax ID. So you could have multiple NPIs under a tax ID with only one primary account holder. However, if you have multiple tax IDs, you need a unique email address for each one of those tax IDs. And again, that information is also documented in the FAQs posted on the DMAS website.
Question, I'm understanding that the PRSS enrollment will not be available until March 21st. There was an email sent some time back that someone in our organization should have received an email on February 14th, Valentine's Day, but we have not received any emails.
So just to make the distinction between provider enrollment, which has been frozen since 2/18, and primary account holder updates. So new provider enrollments will resume on 4/4. So if you have providers that need to be enrolled, you need to wait until 4/4 to do that. If you have PAH updates that need to be processed, again, if you're active, you can go in to the VAMIS portal now and update your account. If you're inactive, you need to submit a form beginning 3/21.
One other question. How do the provider know how many NPIs they have if they don't know where to go to find that information?
Marion, I believe our provider helpline can assist with questions about their provider demographics. If they should reach out to the helpline and we can provide that information. I believe it's in the FAQs as well, and also on the VAMIS portal, the information for the helpline.
Yes, true. They can contact the provider helpline and also through provider enrollment until that's shut down.
And Brian, that's the last question I've received.
Okay, great. So I did get one question, I guess, sent to me privately, where a provider did email ask MES at DMAS, and the email came back undeliverable. Perhaps there was a typo there, but you know, if someone could just go over our contact resources and you know, focus in on where to send questions or maybe even complex questions, how do we want to handle those?
Yeah, if you on the slide that's up here on the screen, we do have that askmes@dmas.virginia.gov, and in addition, again, as a reminder, we will be sending out that Medicaid memo that will have various links as well as telephone numbers in there for you to contact. And please pay attention to the dates that are associated with those telephone numbers in particular, as we are transitioning from one vendor to another. It is very date sensitive.
Okay, and we're over time for the day. And we again appreciate your willingness to join. We had around 200 people on the call today. This is very helpful again to us as well as you. Please push this information out to your members of your associations and other friends that may be providers. And we'll be back. We'll post information on the DMS website as soon as possible. And again, look for the memos and more information coming out from DMAS. And we'll stay in tune. We may have additional sessions in the coming days. So thank you very much. Thanks everyone.
Brian, one more piece of information. Yes. Thank you for that closing. DMAS will prepare a document that you can put in your association newsletters, etc., posted on your own websites so that everybody gets a clear, concise message. Thank you.
Yes, thank you. All right, thank you all very much. Again, talk to you soon.